The work I'm doing in my community is with an FQHC, Federally Qualified Health Center, which exactly embodies the spirit and the goal of Prime-LC. I work directly with the Medi-Cal underserved population. That's 90% of my patients in the clinic, and 80% of my patients are monolingual Spanish-speaking underserved Latinos, which is exactly the vision of Prime-LC.
Prime has so many amazing things as part of their training program to try to prepare you to come out into the community and not only be a physician for the Latino population, but how to become a better advocate. And so part of that is, learning the history of Chicano Latinos in this country from a kind of scientific background and historical background, but then leading up to the literature and how the disparities are shown time after time, and all the different studies that people put together to prove that there are disparities that exist in our communities. And so being able to not only live it as myself being an immigrant and going through it with my family, but now reading about it and understanding that it wasn't just my family, but it was across the board, everybody in my community that was going through these struggles and these barriers.
Prime did exactly what it was meant to do. It found a cadre of students who already had this idea of a sense of commitment in this particular direction. I knew coming to med school that I wanted to work with underserved population. I had become certified bilingual in Spanish, but I had no idea how to do it. And I found Prime, and Prime found me, along with my entire cadre. So it created this powerful force of united in spirit and commitment medical students who then, as we've gone out, have known that there's a class each year doing similar work, even though we are all different medical specialties and working all over the state, and some people have even left the state of California.
Prime helped me in many, many ways. One of the ways that I would say was the most profound is it really taught me what my greater role was as a physician, to be an advocate for those who do not have a voice, particularly in healthcare and public health in general. It helped me really understand the social context behind what's happening to people and their chronic diseases. It also helped me understand better how I can really serve them at a deeper level beyond just the clinic walls. And so Prime was the ultimate for me in terms of medical school options. And so when I was applying to medical schools, there really was no question. It had to be Prime. And the reason it had to be Prime was because it really gave me the tools that I needed to think critically and think deeper, to be an advocate. It also gave me the network of support and mentorship that I really needed to have an impact in the community and beyond. And so really what Dr. Mineta created was he created physician advocates and physician leaders to not just change how we do a clinical encounter with people, but to see them at a different level and to be their voice in whatever arena that needed to be, whether it was in our city council or in advocating for healthier food options or changing policies, doing things on a higher level, educating others so that they can also be practitioners who serve and who lead. And so that's what this program is really about. That's what it embodies. And it's focused on a particular population because it's part of understanding all the history and the context and the things that go into a people. And how do you really specialize in that, regardless of what your medical specialty is. And I think in medicine, one of the things that is a lot of times lacking is we look at disease and we look at the drug for the disease and the body systems, but we forget sometimes about the patient. And that's really been something that Prime has reincorporated back into our medical education and our learning that is so incredibly valuable. And that's what makes it such a unique program.
I mean, the moment I step into an office or the moment I step into a very difficult family meeting in the intensive care unit, it's an immediate connection. I mean, I walk in, I introduce myself. Most of the patients that I have very extensive family meetings with are from communities that surround the university hospital, which are a pretty high percentage of Latino Spanish-speaking families and patients. And so, you know, walking in, speaking Spanish, and then using some of the language that is just maybe not in the textbooks or at school, but using the language that you use in your community, it's an instant connection from like comadres, understanding the lingo, understanding the culture, you know, their family at home situation, understanding that they don't talk about end of life because it's a cultural thing, and being able to step in and say like, I understand because I am from that community and I can relate to you, and that these conversations are not had, but these are difficult moments and these are the circumstances we are in, and now we have to make decisions together. And so, you know, I feel like there's a trust that is laid out when you walk in and they understand that you understand and speak their language and their culture. And it just opens up a gate that I think is sometimes closed when there's some distrust to the medical community.
For me, having the skills of being bilingual in an underserved community, while I am not bicultural, I am able to relate to my patients without needing a translator service. And that language facility helps us communicate on a different level that lets people feel comfort so they can guide you and lead you into their lives. And that next level of insight and sharing is often for us in primary care what helps us develop and inspire and produce healthcare changes in our patients that are what are key to our patients having healthy lives.
If you can't be seen and you can't be heard, how do people know what's wrong, right? And so it's more than just the fact that I can speak Spanish. It's that I can understand the nonverbal cues, the cultural inferences, so to speak, understanding the context, you know, understanding what somebody's path has been just to get to see me, and all the barriers that they had to face to sit here in my office and look at me and talk to me. And so there's so many things that can go wrong along the way in that. And sometimes we don't always realize that as physicians, especially. You know, there's the culture of the person who comes in to see you. There's a culture of the physician. And there's the culture of medicine around them, that context, that healing space that has its own culture. And if you don't recognize those things, you lose what's really going on. A lot of times people come in to see me, but it's not because of what's written on their chart. There's always a deeper reason. And when you listen and you have the ability to humble yourself and try to put yourself into that space with them, you learn a lot more. You can dig a lot deeper. You can really help them understand themselves better, but also understand how can you help them better. And so it's beyond just knowing Spanish. It's beyond just, you know, knowing certain ways to address people. It's really knowing their story and being able to be a partner with them in that story. And that's what Prime does. That's the beauty of it.